Remember the old nursery rhyme about the crooked old man who lived in a crooked house? Well, he probably wouldn't have cared too much about crooked teeth. Most of us, though, don't live in a crooked house, and most of us don't look so good and do worry about having crooked teeth. Here to give us the straight information about crooked teeth is our very straight dentist, Dr. Steve Marsh. Thanks for joining us today.
Thanks, Armin.
Steve, what causes our teeth to shift and become crooked?
Well, you know, there are a couple things that enter into it. Some of it is just getting older and aging. People, if you look at your lower teeth as we age, and we see more of that as we do get older, there's something called a midline shift, and teeth on their own can shift. That's one thing. The other thing that happens is sometimes you've lost a tooth or a couple of teeth, and the teeth then move to what's really a comfortable position for the teeth, but oftentimes it's not aesthetic. It leads to changes in the bite, the way you can chew your food. So that's why dentists are so big when teeth start to shift. Before they actually do it, maybe put an implant in, maybe put a bridge in, something to align the teeth better so that we can chew and be comfortable. So it's not just appearance.
That was that. You took my next question. So it's not just appearance, it actually affects your eating.
It's very much function. You know, teeth are like gears, and they need to move together correctly. And nature did a beautiful job of putting them together. But as I said, teeth can shift due to a number of circumstances. So that's our dentist's job, to put them back together.
If teeth shift and you're a kid and your teeth are crooked, you get braces. Is that what you do for adults?
Well, some adults, even into their 60s, will do braces. But most people come in, they don't want to go through a year and a half or 2 years. Maybe they've lost teeth. Maybe they have gum disease or bone disease, periodontal disease, and those patients aren't good candidates for braces. And in that case, we then look at some restorative procedures. This patient had lost 2 teeth, and oftentimes, actually, in our audience, we may have people who never even developed those what are called laterals, and they were left with that space. And over the years, things had shifted. So we came in here. She wanted something permanent. We did all porcelain bridge work, and it's actually a beautiful result and something she's very proud of.
Okay, what's this?
You mentioned shifting, and we talked about how things can shift on their own. This is an example of a patient whose teeth had shifted. She had actually said to me that when she met people, she actually didn't smile wide. When her family took pictures, she didn't. By the way, Armand, I used pretty much all Golden Opportunity viewers. And so she was inspired by something we had talked about here, and we came in and we did porcelain veneers, again, no braces, and gave her a beautiful smile line. That's actually the day we put them in. And I can tell you that a year later, she's very pleased with it.
Great.
So that's another example.
All right, a new one.
What's very interesting about this patient, again, a viewer, she actually had braces as a child. And one of the things we tell kids, and our viewers can tell their grandkids and their kids, is you need to wear the retainer. And she didn't wear a retainer. She's a musician, and the teeth had shifted quite a bit. She came to me. She also teaches music, and said, what can we do quickly? And we came in here and we did 4 porcelain veneers in the front. We reshaped the teeth. People always ask me, how do we do it? It's a combination of reshaping the teeth and then putting these thin porcelain veneers over. And that's what we were able to achieve. And subsequently, she came back and we did a few more teeth. But
so you don't physically move the teeth. You actually sort of cover them up, basically.
We cover them up and recontour.
Okay.
And this is an extreme case. This patient had all his teeth rotated as he had gotten older, and he wasn't so bothered by it, Armand, but oftentimes it's our wives who drag us in, and his wife dragged him in. And in this case, we actually reshaped him and did porcelain crowns to get that beautiful result.
All right, last one. Do we have one more? That's it. Okay. Steve, this is great information. If somebody is concerned, then do they go to the dentist, or do they go to what's the name of the person? Orthodontist.
You know, it's a great question. Usually you go to the dentist first. We like to quarterback it. So if a patient's a good candidate for braces, we might send the patient there. Sometimes it's braces and veneers or crowns, and sometimes it's done just with veneers and crowns. So we like to quarterback it and do exactly what's right for that particular patient.
Thank you, Steve.
My pleasure.
Help your teeth get on the straight and narrow. Give Steve a call. His number's next.
For details and ticket information for the Cleveland Film Festival, call 216-623-3456 or log on to www.clevelandfilm.org. Next, the ABCs of Part D.